The outskirts are more rural. You have to travel from one area to another. It takes you 1 hour. When you have a small settlement, you find 8 IDP families. The main concentrations such as Ladama, Gulbahar, these areas are now done where we got big caseloads. But there are some areas where we have security issues. For example, Rigi area, there's some parts of Kohad Road, Badaber, Matni. These are the areas where we're having problems with the security. However, we are working out how we will send these people back to these areas as well. It has to be with civil police in civil clothes, arms not visible, accompanying the teams. So it has to be cleared area. The police has to clear the area a day in advance. So there needs to be mechanisms. It doesn't mean we won't go into the area. We will cover entire Peshawar and we will go to the other districts as well. So far we've been providing resources to this assessment. There has been some funding now available, which I will ask Ahsan Saab to also to inform how we can do it. We need to have a consultation today, because this funding we can give to only those enumerators or organizations who have absolute funding crunch and they will not be able to continue anymore. So we need to ask other big players in this assessment to continue with their resources, but others, national NGOs mostly, who have problems, who would like to concentrate on them. But we'll have a discussion on that. Just to give you an idea, as a project, this has been now launched. What we're saying is estimate project timeline we think is 50 to 90 days to cover the entire NWFP area. However, this is a continuous process. What we're saying is if the caseload is around 110 to 180,000, depending on 1.3 million figure that is coming out all the time from the WFP food distribution, the government registrations. If one numerator is doing 15 to 20 households a day, 100 numerators can do 1,500 to 2,000 households a day. We think maybe 2.5 to 5 months we should be able to assess all the IDPs. But this is also a tool that we are now taking out for registration as an alternate to the registration. There needs to be a discussion at the government level. If they agree, then this will become the primary registration tool as well. We won't call it registration, we'll call it profiling. But what will happen is, whenever in the area IDPs come, immediately teams will be deployed, 60 to 70 teams, and they will start to assess people. This is much easier than people standing in lines. This is much easier. This is much flexible as well, because you're not relying only on ID card, but also on if a focal point of an IDP can say, yes, he's from that area. Yes, we know him. He's our neighbor in Bajod, Kuram, wherever. Or if he can show bills, or if he can show registration at with the army there, or any kind of proof, we will register them. But at the same time, we will go through a check of vulnerability. Not everybody will get assistance. Maybe new IDPs coming in will get all of them assistance for 2 months, but then automatically the vulnerability criteria will kick in, which means only the poor will start to get, and which will be much more, in terms of resource mobilization, it can work much better. The humanitarian country team, where all the heads of UN agencies and NGO consortiums and other ICRC and other partners sit, they've come out with this coordination mechanism. So, steering committee to drive policy, operational committee today, this is the meeting as the operational committee. Technical committee is something which will be chaired by UNICEF and the WAM unit, and they will have, this will also include the software people, the data management, how to have more technical support into how the tools needs to be improved, where areas, all the technical aspects of this assessment, that will be taken care in that committee. Operational committee will look into most of the operational details, resources, how many enumerators are there, how many logistics, which areas that you propose should we go next, any funding, any agency required to continue this, all these things will be taken care in this committee. We will go by consensus. If everybody feels we should go in a certain way, we will make sure that we go in that way. The coordinating agency right now is OCHA, but there is a handover already worked out with IRC. the funding which is coming in will be channeled through UNICEF. UNICEF will be the major, which will be receiving the entire funding, and then they will have a implementing partner agreement with IRC. Our IRC will do the entire coordination on ground, with McRAM team also part of their technical support as well. Initially we thought, because of the funding, we had some issues on if IRC can continue to do this, because we wanted them to take this project directly. However, that has been resolved. It has to be channeled through one of the UN agencies because of the nature of the funding that is coming in. Okay, just to go a little bit into a process, the first stage is to identify IDPs. We're working on two areas. One is the teams are going into areas which is based on IRC protection teams concentration matrix. So they have already mapped an area within that, they know where the concentrations are. We get data from them and then we go into that area. There's a mass communication campaign going on radio and also through leaflets by IOM that also mobilize people. Then we have a call center coming up. The call center concept is any IDP can call a toll-free number and they can identify where they are located. The software actually puts them on a pool where we know how many families are waiting to be assessed. They can SMS without writing anything, a blank SMS to 777, and automatically the call center will call them. When the call center calls them, there's an initial form that they ask over the phone and they fill out. The reason we went for a call center is 95% of the people, IDPs, have mobile phones at the moment. And we are now calling them to verify the data already. So, which is quite encouraging. You can actually talk to all your IDPs, even if something in the data doesn't look good, we actually call and verify on that as well. The assessment itself then goes on through PDAs, then managing the data and analysis, where we are asking VAM to help us a lot, but we also have a software that has been installed. Then the software is automatically applying vulnerability criteria. This is a scorecard approach, but built into the software. However, it has a human interaction. People who are on borderline or we think should be vulnerable, there's a human check to it. On each of these cases will be checked by a protection staff. Once they go through the criteria, they can go to any of the food hub. They will get a magnetic card with photo on it for IDPs. And this is something we're talking with the WFP food hubs, how we can integrate the software already with their software so the beneficiary list can go there directly. But for other humanitarian community, the data will be available to anybody, any organization who wants help. So we can provide you all the assessment by name and by family name, by how many children, names of the children, where they're based. A very detailed database is available, and that can be provided to all the humanitarian community online as well. They need to sign a disclaimer that this information will not be used anything against IDPs, either given to the law enforcement agencies or the government, or the data protection will be maintained. If that's been signed, then we can provide. But certain cases which are most vulnerable, we will only go through the protection cluster. For example, slightly small, but we have 9,797 families. 9,797 families. Data which is currently cleared, which is about 54,000 people. If I show you, there are different indicators here. This is based on the questionnaire that you can pick any indicator and you can get the results. For example, if you want to know IDPs by place of origin, right now the 9,000 families we're talking about, where are they from? And this is you will get. For example, we have the biggest caseload from Bajod, which is 32%. Then we have 2381 families from Oman. We have 25% families, which is 2529 families from Kuram. These are the three big ones. For example, if you want to go into Bajod, we simply click this. This is your beneficiary list. So where are